Hi guys, so something kind of easy to work on while I'm gone that might help is to go ahead and we're going to customize our search function. So here in the LitKit Adverse Effect, these are all the translations and pictures that we worked on and the text that will appear on those adverse effects. This only has to be done for adverse effects, not counseling or processes. So something really helpful to do is to look at that adverse effect and realize that anytime the patient inputs the search function or the provider inputs the search function abdominal or pain, this is exactly the adverse effect that's going to come up. However, some are a little bit more complicated. The provider might not input nitrogen, they might put in azotemia, and that's okay because we have both of those here just to make sure that the provider is able to search this azotemia using either one of these terms. But some of them are a little more complicated and we may have to put in ourselves. So for patches of skin color or changes, the provider might not put skin, they might not put skin color, but they might put the medical term for that here. That one there. So that's really important to go ahead and include. And essentially you're just going to include as many possible options here in the medical term as possible. So for this one, you don't have to put decrease and hormones and so on because it's here already. But you might want to put adrenal suppression, again, the medical term, or another simple term that you can think of that means the same thing. For something more complicated like this, it really doesn't need anything that you don't have to input any of these individual symptoms, but if you can think of a word that encompasses all of these symptoms or a condition, you can go ahead and put that here in the medical term. Okay, you can use a thesaurus for that, or you can also just Google medical term and try to come up with that. I hope that's helpful. We're only going to do that for this document. Feel free to go in other sections if you want and just try to get as many done as possible. All right, thank you.